The process of establishing a national society in Maldives began in 2005, initiated by a group of volunteers of the Maldivian community who recognized the need for a Red Cross, Red Crescent national society that will provide humanitarian services to vulnerable segments of the Maldivian population. On 28 April 2009, the Maldivian Red Crescent Act was passed by the Maldives Parliament and was ratified by the President on 7 May 2009. MRC First General Assembly was held on 16 August 2009, through which MRC was officially established. Maldivian Red Crescent is a voluntary humanitarian organization established in the Maldives. It is a member of the International Red Cross and Red Crescent movement. Its mission is to volunteer, participate, and partner in delivering humanitarian service to the most vulnerable with a vision to be a model national society contributing to overcome humanitarian challenges. The primary objective of MRC is to prevent and alleviate suffering with complete impartiality, making no discrimination. Our services and programs are implemented through MRC branches and units. MRC started its branch development process in November 2009 as part of delivering services to the communities of Maldives and increasing its outreach. To date, MRC has 10 branches at atoll level and 20 units at community level. MRC branches and units are at the heart of the community, where volunteers and members support to deliver our programs, respond to emergencies, and conduct humanitarian services every day. The Third General Assembly of MRC was held in 2011, where MRC adopted its Strategic Plan 2011 to 2015, which defines 4 main strategic areas: disaster management, health and social care, youth, and organizational development. MRC implements several programs and services in community within these 4 areas, such as first aid services. MRC also provides first aid service at sports events and public gatherings. This is a free service and is meant to create goodwill and increase awareness of the importance of first aid and to give visibility to MRC as a leading first aid service provider in the country. Community-Based Health and First Aid, CBHFA. This is MRC's first community-based program, which provides health messages and prevention messages. This project is being implemented in 20 communities since February 2010. Community Empowerment through Women Empowerment Project. The objective of the project is to build ownership of MRC branches and units by building their capacity and empower women in delivering services in their communities. Community-Based Disaster Risk Reduction, CBDRR project. This project targets 6 individual island communities with focus on disaster preparedness, mitigation, and response components to build community resilience. Emergency First Response Services. Maldivian Red Crescent is in the process of developing an emergency first response team. Community Empowerment and Capacity Building Project. This project is aimed at building the capacity of MRC branches to deliver services to their communities. Youth Empowerment Project. Youth Camp was conducted for 28 participants from different branches of MRC to address youth issues and underlying factors affecting youth in Maldives by encouraging youth to find solutions and advocate on their behalf. Through the second part of this project, youth representatives, in coordination with their local branches, implemented youth activities by implementing small projects they designed during the youth camp and other activities to increase youth leaders in MRC governance. Violence Prevention Project. The main expected outcome of this project is to reduce the risk of violence, especially against children, within the Maldivian Red Crescent and the communities in which it works. Commercial First Aid. Commercial first aid is being developed as a means of internal resource generation. MRC conducts trainings for local businesses upon request. MRC Japan Fund. The Maldivian Red Crescent on 16th March 2011 opened a fund to support recovery and relief efforts in the aftermath of the earthquake and tsunami that struck Japan on 11th March 2011. The purpose of MRC's Japan Fund was to provide a means for the public to assist the Japan relief operations. MRC was able to raise $33,296 which was sent to the Japanese Red Cross in May 2011. Dengue Control Operation DCO. During the June 2011 dengue outbreak, MRC mobilized for the purpose of conducting dengue control operations in the Maldives. Within the operation, MRC disseminated IEC materials to 190 islands, conducted school-based awareness sessions in 20 schools in Malé, and cleaning and other activities in severely affected and MRC branch unit communities. MRC also disseminated dengue prevention messages to expatriates residing in Maldives in their local languages. MRC is privileged to have dedicated volunteers, members and staff investing their valuable time and hard work to ensure quality delivery of humanitarian services to people in need. Maldivian Red Crescent was accepted as the 187th National Society of Red Cross Red Crescent Movement by the International Committee of the Red Cross on 9th November 2011. In addition, MRC was admitted as the 187th member of International Federation of Red Cross and Red Crescent Societies (IFRC) on 23rd November 2011 at its General Assembly.